Hi, all. I want to welcome you to tonight's seminar. I'm sorry that we're letting you all in a little bit late. We had some technical difficulties. Um, so I'm not going to take too much time. I just want to welcome you. I do want to let you know that we're using focus mode tonight with spotlights. So um, our presenter, Tammy, will let you know at the beginning if she'd like you to put your questions in the chat box or if she wants you to unmute and just chime in when you've got a question. But even if there comes a time when you unmute and chime in, your video is not going to be included in the archive, just your voice, just the audio. The only people that will see during the presentation are the me talking right now, our speaker, Tammy Moore, and our MCHSA president. I'm going to shift it right now to the MCHSA president so that she can introduce our speaker.
Lovely. Thank you so much, Julie. Hello, everyone. Good evening. Thank you for joining us this evening. It is my pleasure to welcome you all to our November MCHSA seminar. My name is Chidima Ndubisi-Oluwavu, and it is my pleasure to join you all tonight as the president of the Maternal Child it's been a long day. Maternal and Child Health Student Association at UAB. Joining me tonight, we have Tammy Moore, who serves as a state parent consultant for the Children's Rehabilitation Service at the Alabama Department of Rehabilitation Services, who will be talking with us tonight and sharing a little bit more about how we support the parents of infants with special health care needs. Without further ado, Tammy, take it away.
Hey guys, it's good to see you. Sorry that we've held you up. I'm looking at my first slide and I'm like, how did that change? Because I could swear I put infants, but it says children. That's fine. It applies anyway. Hey, we can go on forward. I'm so glad to be here and appreciate y'all coming in. I'm going to move right along so we can get to it. So, when we're talking about supporting parents of children or infants with special health care needs, in my mind, there's 5 crucial factors: collaboration, communication, compassion, connections, and community resources. And resources really didn't fit there, so I put community resources so I could keep up with the C theme. We can go to the next one. So we're going to start with the power of collaboration. So here's the facts. And then we'll move on to parent comments. I was so blessed with so many parents who took their time and their effort and shared their hearts. And so that's going to be the good part. We'll get to this part first. So, healthcare that is built on a mutually beneficial partnership between the provider, patients, and family. So, we're a team. I'm big on teams, and families are a huge part of that healthcare team. Their patients and families are active participants in the roles and responsibilities in the care process. Um, I think of, the healthcare provider as being there, and yes, they're experts in their field, but those parents are with those children all the time. So it is so important that we collaborate with their families and communicate with them clearly. Patients and their families are involved in healthcare decisions that are meaningful to them. And so there might be some things that are, just pretty much cut and dry that we'll just move on along with. And then there's things that really mean a lot to us that we really want to take a deeper dive into. Our next slide. Okay. So these, like I said, are comments from our parents, and this is what they really wanted to share with you guys. Things they felt were important for you to know. So, the first, let caregivers know ahead of time what orders, blood work are placed, and ask for parents' input, what they prefer to check, whether in or outpatient. And then, there's a lot of work on that side too, collaborating if there's multiple tests needed for a child from different doctors in the same medical space. And the next slide. Oh, okay. So his genetics physician finally said he felt strongly that Sydney probably had some type of genetic disorder, possibly one that had not been identified at that time. When I mentioned to him about Sydney's birth experience, he brushed it all off and said babies with health issues tend to have difficult births. This mother was coming from the point that that birth experience was traumatic. That umbilical cord was wrapped around his neck 4 times, and she felt, it was CP, and she was brushed off, and there was no further conversation about it. So to continue that conversation, either for the knowledge of that physician, to learn more about that history, or for her to have an understanding of where he was coming from, would have been super beneficial. I'll give the next one. Respect my knowledge about my child's condition and the expertise that comes with caring for her daily. Engage me in her medical care, and everyone benefits. So important. Let me go to the next. Please partner with parents. The provider may see all of the medical imperfections, but as a parent, I see my child perfect in every way, and they're fiercely loved and wanted. You go to the next. We're going to move on to the power of communication. Communication and collaboration can cross over with one another, but communication is key in so many things that we do. When we're working with families, it's very important to listen and honor that patient family perspective and their choices that they might make. We may not always agree with them. And we have to move on with that. Complete and unbiased information is communicated so parents and families can make informed decisions. We need to know the story, the whole story. And if we have questions about the jargon you're using or procedure that may be coming up, just be thorough in sharing. Sharing honest and unbiased information with families on an ongoing basis in ways that they find useful and affirming. So always be honest and biased, but at the same time, have some compassion thrown in there with that. Go to the next slide. So here's the family comments on this. I would advise doctors to listen to us, the caregivers. Listen to parents' concerns, ask questions, and read between the lines. So I feel like, in that former slide, that's what happened. That doctor did not listen to her true concerns and didn't ask her any questions and did not read between the lines at all. He just dropped it, brushed her off, and a lot could have been, they could have moved forward with a lot with that. Her son is an adult child now, and they still have no answers. Okay, we'll go to the next slide. Listen without interruption. That's pretty much what it says. I mean, we tend to want to say, but, or, and. Let's just listen, and when they're done, we can, say what we feel like we need to follow up with. The next one. Dysmorphic. The jargon. That word, it means a lot to me. When I had my daughter, she was my first daughter, my first child with my second husband. She was very special to us. I have 2 boys, and to have that girl and be able to dress her in all the fluffy pinks and do other girl stuff, we were so excited. And we were dressing her up in her little lacy pink dress with a little pink roses that Mimi had given us to take her home in. And in walked a doctor. Dr. Proud. I'm going to go ahead and share her name. And she introduced herself as a geneticist, which I really didn't understand what that was. Just very, very taken aback that she was coming in when we were getting ready to leave. And she said that she had some concern. She had seen Kelsey and felt that she had maybe a genetic condition, and she saw that because she had dysmorphic features and her ears were low and all these things. And my husband and I were a little insulted that dysmorphic, the word was just sounded so horrendous. So she's describing my child with this word. She just wants her money. We don't need to talk to her. There's nothing wrong with our baby. And we dismissed her, told her that if we needed her, we'd get back with her. Well, I think it was about 3 weeks later. It was a little over 2 weeks. I ended up with my daughter in Failure to Thrive Clinic. Her pediatrician didn't listen. I said, this doctor came in and she said that Kelsey had these genetic things, something going on. And I'm really worried because she's continuing to lose so much weight and she screams all the time. And he said, oh, she'll be fine. All the kids, they all lose weight. So I took her to an internal medicine doctor and he said, Tammy, I'm going to tell you the truth. I have no idea what's going on, but I want to follow up with her day after tomorrow, bring her back. We're going to weigh her. If she has lost an ounce, she's going to Children's, to their Failure to Thrive Clinic. We ended up there. And that was a very difficult experience because I felt that they were judging me and insinuating that I was neglecting her. And I felt like a human pacifier. I was trying to nurse her. Bottles didn't work. She just did not have a suck. And I said, call the lady, the little lady who came in after she was born, and we were leaving. I can't remember her name. It was sad. It was a P word, Oh, Dr. Proud. It was Dr. Proud. And here comes little Dr. Proud, and she saved me. And the woman that I disliked so fiercely ended up being one of my best friends in the whole wide world. And we spent a lot of time and years, and she dedicated a lot of her career to Costello syndrome that she diagnosed Kelsey with 2 years later. So watch your words. I'm going to the next slide, or the next little comment, rather. What I would love for all pediatric professionals to know: you all have great knowledge in your respected fields, but listen, really listen to your families. Don't immediately judge a situation and think you have all of the answers without truly listening to the parents. We feel unlistened to, unheard so many times. And I truly believe in my heart, I'm not just saying this, that things have gotten better, that we are listened to more, but we can't forget. I say, I believe things have gotten better. Well, I've been at this, in this kind of work since, well, I guess really 1998. And I see history continually repeating itself. Things get better, and it's like we've gone 2 or 3 steps forward, and we go 4 steps back, and we go 2 steps forward, and we go 1 step back. So it's a constant thing. So let's just always keep in mind to listen. And the next comment. The mailbox story. Y'all are getting 2 of my stories on this one on communication. Kelsey had a lot of medical problems, pretty complex there in the beginning. And one of her doctors had ordered an MRI. And we were concerned, and I really didn't know. I was learning as I went. And I really didn't understand what they were looking for, but they were really concerned that she had some neurological issues. So we get the MRI, and the doctor said, we will have those results to you by Thursday. If we don't have them in, just call me on Friday. Well, of course, I called her Friday morning when I didn't get them on Thursday. And I'd known her pretty well, had developed a relationship with her. She actually was part of our first conference that we had in Birmingham for Costello syndrome, had really opened doors to Children's Hospital for us to start research and all the things. So, I loved and respected her too very much. But I was sitting on the front porch when I called her, and I said, she said, "What's up?" I said, "Well, I never got the results back from Kelsey's MRI." She said, "Oh, well, we do have them, and I can tell you that she has a Chiari malformation with a retroflex dens." I'm like, "Okay, what does that mean?" And she shared some of the mechanics of what that was. And I said, "Well, what does it mean for her and her well being, her health?" And she said, "Well, Tammy," I can't believe what she said next. "She could die." I'm like, I couldn't breathe. My breath was just, I was like somebody had just hit me in the stomach. I had gotten gut punched and I could not think or breathe. And I said, what? She said, "You need to talk to the neurosurgeon." And so I go in, I hang up with her. I walk into my house, and my middle son, he has Kelsey, and he's throwing her up in the air. And I'm like, "Oh my gosh, don't, son, just give her to me, give her to me, give her to me." I was afraid that all of this would come together and bam, she'd be gone. And it was horrifying, absolutely horrifying. And I took her in and laid her on the bed, and my husband was in there reading a book, and I told him. And we were just totally mortified. I started ringing the neurosurgeon's phone off the hook. He thought I was ringing hers off. His was getting it double. And finally got a call back. It was actually over the weekend, which I was grateful for that. His nurse calls, "Tammy, what's going on?" And I'm like, "Well, this is what's going on." And she said she'd have him call me back, and he did. And he explained things a little bit more. And I said, "Well, again, how does this impact her health and her well-being, her life?" And he said, "Well, I've seen, children go around with this 3 years or more." I'm like, 3 years or more. That's not good either. I just, I can't, I can't absorb all this. I'm all on the phone. And he's, and I was, could hardly speak again. He said, "Tammy, you could walk down to your mailbox today, this afternoon, to check your mail and get hit by a car, and that would be it." I'm like, "What analogy are you trying to use?" But I said, "Well, Doc, I'm just not saying his name. I didn't call him Doc. I called him by his proper name." And I said, "Doc, one thing is that when I walk down to the mailbox, I'm in my driveway, I look both ways and I make sure things are safe before I get around and try to check my mail. And that is all I'm asking of you, is to give me some direction. What are we going to do to protect my child in the best way we can?" So communicate, but communicate in the right place and time, or the right words. I mean, that was just, I hope that never happens to another parent. It was just one of the most horrible interactions I ever had with two doctors that I kept, because they were both marvelous in their profession. I wouldn't have wanted anybody else to do the procedures that were needed, the surgery and all of that. I mean, even went to Georgia and had to make my mind up if I was going to keep her in Georgia with, that neurosurgeon, or Birmingham. I ultimately chose to stay in Birmingham because that neurosurgeon was the best with her condition, and in an emergency situation, all the things, I'd need him and be right there. So that's the mailbox story. We'll go on down to the next. So what would have been the most beneficial to me was a liaison that could interpret medical jargon when I was still in shock of what was happening. Well, I pretty much told one story there, and there was no one standing there by my side to interpret. So if you're going to use the jargon, please remember to define it. Another experience I'm going to briefly share is that I was in an appointment with a doctor, and I asked him, what this medical term was. And for the life of me, I can't remember it right now. A lot of time has passed, but When I asked, he said, well, I could tell you, but it'd probably be a waste of your and my time. Really? That's what he said. So I said, just tell me it again, spell it, and I'll just take it from there. Um, just if you use the jargon, um, always educate. Just always educate your families, whether you're giving them a trusted site to visit, or you give them a brochure, but make sure that either you share it or you give them a good place to go back and look at later to get their information. The next. So the power of compassion. I also want to add here, all these little pictures that you're seeing, there's some of the pictures of the children and the parents who shared all of their thoughts and their hearts for us. Okay. So compassionate care is expressed in action rather than words through sensitivity to understand what a person's going through, the willingness to help and promote the well-being of that person. You might not have all the answers, but we know people, and we should have people on our team or have a knowledge of who can help and direct that family to them. Support and direction and finding a solution to their situation. It just all comes together. Compassion is, can be spoken, but your actions really speak louder than your words. Go to the next slide. This is a good one. It's not a good one. It's a good one. This is really a good one. It's more of a happier one. In a way, you'll see. I had a C-section, and they suspected immediately that my son had Down syndrome. After all the hubbub about that, what I appreciated most was the anesthesiologist quietly congratulating me, my husband, and me on our new baby. He was the only one. Who did that on that day, and really got that it was still their day. It was their very special, wonderful day. And go to the next. Include all the positive aspects of the prognosis, like longevity, the possibility of a normal life, the opportunities to grow into a great individual. What is normal anyway, right? With the best possible scenarios. I'm having trouble seeing this. Sorry, I can't read the bottom. The joy my child can bring. My child, even through all her difficulties, she's 32 years old now, so it's been a hot minute, but she brings me such joy every day. And I wouldn't tell people over and over, I would not change her for anything. Wouldn't change her. I would change some of the things she's had to go through, all the surgeries she's had, quite a few, and some of them horrendous. But she's survived them all. She's a fighter, and she has a hard goal. And go to the next one. A few important real life stats to remember. This is real stuff, and it's scary. The divorce rate for couples who have children with special needs is very high. A recent article suggesting it is at least 80% compared to other couples. The stress level of a special needs parent is heightened to the level of combat veterans due to constant caregiving, financial strain, managing challenging behaviors, and navigating a complex medical and educational systems. Wow. I have felt before like I was in a combat zone. You can tell from a few of my stories there, but 80%. And I'm going to share openly and honestly that my husband and I, we had some times there at the beginning where it was so stressful. Kelsey ended up having to have a G-tube. And I had to make that decision myself because he just wouldn't. She had had an NG tube and she developed pneumonia. She was in the hospital. And, we talked about it before. And so after she recovers from this, they felt the doctors, their team felt it was really the time to go ahead and move forward with the G tube. Well, I made this decision to do it. That G tube, it popped out all the time. I was putting it, then in G tube, excuse me. It was popping out all the time, and I was having to put it back myself. And very difficult. She was very small child. And we'd end up in the ER, and they had trouble and couldn't hardly get it down. It was just too much stress. And that's one thing I was educated on enough that I felt like I was moving forward with something that would be best for her. And I'm so glad I did. But he was so upset. The evening of her surgery, he just laid his head over the side of the hospital bed and just moaned and groaned and wailed and wept. And he was mad at God. He was mad at me. And it was a very hard time in our lives. So I really go with that statement that 80% still is blowing me away. But I can see how it has impacted my life, and he's my one and only true love. My Prince Charming, and we still have trouble. So let's go to the next comment. Parents may have other pressures on their family in addition to concerns about the newborn's diagnosis and special health care concerns. Like, I have 2 other sons, and they've got to go to school. We got to manage that somehow. And, they would love to play baseball. Who's going to take care of them doing that? And us taking care of her. I may have been unable to work now because nobody will hire me because she has so many needs and so many therapies she did at that time. And I see so many families who continue to live that life where they're unable to work because there's no one to care for their child who has these complex medical needs. It impacts so many things. I can go on and on and on. So we need to be compassionate and think about where people are outside of their health care for their child. Let's go to the next. As a parent of a newborn with severe complex disabilities, parents may be in a kind of a shock, and she's referring to right after that child is born or diagnosed. They are managing the gap between expectation and this new reality about their newborn. It's like, I totally get it. I felt that way. I had my beautiful little baby girl, and then somebody comes in telling me she has dysmorphic features. And, that was my first little shock. But then I really got hit hard when we ended up hospital in failure to thrive. That's when it really, really hit us hard. So it is, we really need to attend to the mental health of our parents too, and think about that. And don't forget the siblings are so much. We're not in our own little boxes. We're all impacted in some way. We can go to the next. The power of connection. That is my son, my middle child, and this is Kelsey when she was in ICU after she was born. She was the biggest baby in there. She weighed 9 pounds, 6 ounces. I had polyhydramnios. She was huge. I was huge. And then she just shrunk to nothing. So connections. Connecting a parent to another parent of a child with the same or similar needs. Diagnosis can be very beneficial. I don't think anything helped me more than that. I found a family in the UK. It was the beginning of the internet. Kelsey was born in 93. And it was amazing to have another parent, even though we were tapping away, that's how we communicated, to just learn from each other. Because Kelsey was the 18th. I didn't mention that. She was the 18th in the world diagnosed with Costello syndrome. So it was hard to find anybody. We're around 400 odd now. Support groups offer a needed sense of community where families can learn from one another's experience. Because we can feel so alienated, and to know that even though, the people in that group might not have a child with the same diagnosis they may, it just gives you a huge sense of community and way to learn from one another. And it's important to also think of connecting parents we have those complex needs, special health care needs, to care coordinators or case managers to help them navigate the systems and care and access resources they may need. And when we think of connections in this, you know, in what we do, we typically think of parent to parent support groups, but we may not think beyond that to think about what other connections are super valuable or can be to a family. And I really believe in care coordination, being from children's rehabilitation service. That's like the core of what we do, and I can see it and how it works in supporting families and getting them through all the things that they have to get through. And in the case of the birth of a child with special needs, the opportunity for the child and parent to bond is crucial to the well-being of both. I mean, you have this child who has these complex needs. You don't get that, little bonding time right after they're born. They usually are snatched away, or if they even land on you at all. And then it might be days or longer before you might even see or touch them. So that first available opportunity, when it's even close to being possible, given some time, some moment for the parent to bond, or parents to bond with their child, is so crucial. It's so important. It's for that baby and for the parents, for that family. I mean, you saw the picture of Landon, my son. It was important for him to have a time just to touch her. They were so scared. They were so scared. But to see her and being able to touch her was all that made all the difference in the world. Go to the next. Comments from parents provide a place and time for both the parents to bond with their child. Um, there you go. They said it too. Let's go to the next. Connect parents with caseworkers from these agencies as appropriate, and note that each caseworker will specialize in their corner of their specific agency specialty. So it's good to be set up with multiple caseworkers, and they were referring to, CRS and maybe the hospital and so forth. But see what's available to, if there's eligibility criteria here and there with others, but just see what might be available to that particular child and their family, and make an effort to connect them, because we were not born knowing all this stuff. I had no clue, not a clue. I did not learn about CRS till Kelsey was 5, because I wasn't born knowing this stuff. And back then it was harder to learn because, like I said, the internet was new. And even though we have that now, there's so much to get lost in. So it's so important when you make a connection with a family that you share, and get them hooked up. Let's go to the next. We need to connect with other parents of special needs families in a structured, supported way so that we could learn from, support, and build a community with them. So huge. So huge. It makes you fit in again when you have a child with special needs, and everybody, complex needs. And all the other mommies all they're worried about is, their next or a photo op, or when she's going to crawl. Well, you're all about the photo ops and hoping that they'll crawl. But there's just that disconnect, because while they're running to play dates, you're running to therapies, and it's just a natural parting of ways. And so when you can find the support and others who get it, it can really give you a sense of belonging again. Go to the next. I think what supported me most was probably having other parents that were in the same boat to help and guide, encourage me throughout my journey. So true, so true, so true. Always helped me. I always try to make a point, and I still do, that I find a parent who has a child that's a little older than Kelsey, and because they've already, walked that walk. Let's go to the next one. My most precious memory was the very first time I was able to hold him. Elijah was born in September, and I didn't get to hold him until February. I can't imagine. I can't imagine. I remember this first time that one of the nurses came in and she said, "Mom, you're going to get to hold him." It took about an hour for them to get him and move all the tubes and everything. She said, "I know that you need to hold him. I know that you need to feel him." And he needed to feel her too. It's one of the most important moments that a mom can have with her child is to hold him for that first time. To imagine that she had to wait so long. So just work on those connections, and I'm sure there were reasons, because I know he was very complex, had so much going on. But as soon as you can make it happen, let's make it happen. Okay, here's the next. The power of community resources. That's me, young and skinny, even after having her. And I thought I'd gained so much weight. I wish I was there now. That Kelsey, you could see her. She was, she looked swollen. She had so much fluid and there's so much going on. But she really went down to the nothing. That was in the hospital after she was born. So the power of community resources. I love me some resources. If anybody knows me, they know that. So let's go to the next. It'll go. There we go. So, of course, I'm big on my Title V, working with Children's Rehabilitation Service. We have care coordinators, parent consultants. We rock. We have one in almost every one of our districts. We got a couple more to fill. Then we have medical clinical. It's just we're supporting families through as they navigate. Those care coordinators that help them navigate systems and connecting them to resources. They have parent consultants that are there who get it. I can sit for the moments. I'm not a nurse. I'm not a social worker. I'm not a doctor, therapist. I'm a mom. And I get it. I've been there. Our children may be so different in so many ways, but I promise you that we have or will have the same paths in our lives, some little places that are touched with the same experiences. And I'm here. I'm here for you to support you and to have an ear and a shoulder and offer resources and all the things. So that's very unique. I feel like all God's children need a parent consultant in their office. And then we also have information referral, which is pretty much tells you what it is there. So, and then support groups connecting to those can be vital. Insurance, huge. Medicaid All Kids, private, ALHIP. I don't know if y'all are familiar with that. If anybody wants to ask about resources, my number is at the end, my email. Medicaid waivers, respite, the benefits such as SSI and SNAP. The list goes on and on. Financial support, things like Libby's Friends and CRS. And there's so many things, just so many things that we need to try to be aware of in our practice. Have somebody that we know who knows. If you could just make those connections, connect the dots with people. I don't know it all, and if anybody ever catches me saying that, they need to commit me because no, it's will. But so important for us all to network and have a knowledge of different people who might support families in different ways. We'll go on to the next. These are comments. I didn't receive much help at all when my son was little, unless I found the resources myself. CRS was a great help, kudos, and still is to this day. I wish providers would offer more information on things that can help. It's so often that, you go to the pediatrician's office. No one in my pediatrician's office mentioned CRS. And Kelsey was blessed to have a pediatrician who hooked us up with early intervention. But early intervention didn't tell us about CRS either. So we need to get better at that. And I hope that we are. We are in some ways. But like I said, it comes, it goes. Um, so we just need to be intentional all the time and pass it on. Okay, we can go to the next one. I wish that someone had shared specific resources on what programs are out there to help with assistance. My daughter could have qualified for disability in the early years, and no one let me know, which caused some financial strain for our family. Um, like I said, it can be super impactful just sharing, that one word, that one phone number, that one person. Um, I've been there. I mean, you could be down to just eating beans, and it is not any fun. I'm telling you, it's not. Because when things happen, they happen. I mean, there's been times when I wasn't able to work, and then my husband goes on strike. So what do? Things can get pretty bad. But we just need our people, and you guys need to be our people. Let's go to the next. Specific resources on what programs are out there to help with assistance. Well, this is a repeat. My apologies. Let's go to the next. I stayed up late doing that. That was probably about 11 o'clock or so. And go to the next one. I believe that parents should be given resources as soon as possible. I'd asked a question of this one parent about at what point did she think you should start really giving all these resources out, because aren't we overwhelmed? What are your thoughts? And because I've heard it both ways. You're overwhelmed, the parent giving them all that stuff. Well, then they leave and they don't see anybody that has that information or shares it. So she made a good point. And with her comment, um, they should be given resources as soon as possible, even if they are not digesting it, they are hearing it. And when it's time, they will be more familiar with the conversation. Nothing is worse than walking out of the door and not knowing what you will need or where to go for it. I learned about resources and support, but I wish I had support started earlier, like when I first was at the hospital. Go to the next. So just final tips and takeaways. I appreciate you guys hanging out. So the parent and caregiver should always be included as part of the medical team. Listening is a vital part of communicating with families. It enables understanding, helps build trust, and is crucial to collaboration and care. You can't provide good care if you don't know what's going on in the family's life and if they're going to be able to carry out your plan of care. And drop the jargon. If you have to use it, explain it, direct them, give them some guidance. Compassion is communicated by our actions as well as our words. And the first thing we usually think about when we talk about connecting families is parent-to-parent support or support groups. While these are very important, connection and care coordination can help families access the care and resources needed. And don't forget, parent and child need to bond as soon as they're able and long as they're able. Resources can help a family financially with high medical costs and loss of income. People often think of the financial burden being the cost of the medical costs, but they sometimes forget that it can come from a loss of income too, because one parent has had to quit their job because they need to take care of their child, or they can't find a position that'll accommodate the appointments needed for that child. And that can offer relief and respite and so much more. Um, that can help families to survive and thrive. So just be sure to share resources if you're not aware of certain things. Hook them up with a parent consultant or a care coordinator from Children's Rehab, a social worker, just anyone that you know who is on top of that kind of thing. And we go to the next. I had to do a slam. This is Kelsey and my husband and myself. Um, that big picture down there is a picture of one of our conferences. I chaired the first conference in 1999 for Costello Syndrome Family Network, and we've done them ever since, every 2 years, and learned a lot. We have best practice. I mean, it's just amazing. We've made connections that are lifelong. You see Kelsey with a flamingo head, Danielle. I mean, she's got friends. She loves to go to see the Friends Like Me. There's Kelsey after one of her big bad surgeries. So, y'all have any questions? We've got 4 minutes for anybody that's still here. I think somebody asked me that question. Was it Julia?
Um, yeah, there was a question that was posed um, as a part of the registration process. First of all, thank
Mhm.
you for
Sure.
sharing all of this information with us, and especially um, just being so vulnerable and transparent with us, and sharing from your heart. I've taken myself off. I put the spotlight not just on you anymore, but also on me and on our president. And the two of us will try to help you facilitate this question and answer session. The question that was posed during the registration process was, can you discuss your pathway to becoming a state parent consultant?
Okay. So that first, my first encounter with CRS was Kelsey going through a CT clinic referred from school, and I had met my friends from Manchester, UK, and we were talking about having a conference. And so he was IT kind of guy. He's going to set up our website and all those things, and I was going to do the conference thing, and there weren't that many families in the world at that time. There was probably going on 30, maybe. So this was 98. And so I didn't have a dime, not a dime, not a penny, no money at all. I don't have this conference. And so I was looking away around for a free space. I didn't need a huge space because I didn't expect to have that many people. And I ended up, to make the story a little shorter, at CRS for an ACT clinic. And one of the social workers, care coordinators, she said, Tammy, I hear there's going to be a conference for Costello syndrome in Birmingham. I said, yeah, that would be me. I have no money, no place to go. I've been to Shriners. And she said, well, we could probably help with that. OMG, did they help. And so they helped me with that conference. It occurred in 1999, and a couple of years later, the position came open, and they just asked me if I'd be interested in being a parent consultant, and I'm like, "Are you kidding me? I'll get to do something I love and get paid for it. I'm not getting rich, but I get paid for it." And so that was in '02, I think. And I stayed with CRS, and I left for a hot minute to go help my sister. She had a design business. Left a year, missed it so much. I had to get back to my family's. It made me sick. I missed it so much, and I got to go back. And then I stayed a while, left and went to be a director of a nonprofit for about 5.5 years, and I came back, and I'm just passionate about it, and passionate about our families and about what we do at CRS. And that is it's just uh, the way it occurred. And I've so happy to be here and continue my journey. I tell them that I'll probably have my funeral services will probably be in the waiting room of a clinic somewhere. Yeah, they'll have to drag me out in the coffin.
We had another, I know we're right at 6:30, but I'll pose this last question.
Mhm.
And then uh, as soon as we sign off, I'm going to be sending out an email to all of the registrants that has a quick evaluation form. And if any of you think of a question later that you would have liked to have posed, just answer that email back and pose the question, and we'll make sure and get the question to Tammy and get the answer from her and send it out. So this last question is, care of the caregiver is so important. Can you share some respite programs that are available?
Well, it's all relative to where you live. I know a lot of churches have them. Um, Alabama Respite can be a good resource to touch base with. Now, if you were going to ask me right now, I would say camp is great respite. Kelsey goes to Camp Pasco. There's Camp McDonald. There's all these other camps. But if you want a better list, I told you I don't know it all. I would talk to a care coordinator at Children's Rehab. And then we have another parent consultant in Birmingham area, Godwin Powell, who is very awesome. I pretty much would have to look at my list to tell the truth. And, having a Medicaid waiver offers respite too when you have that.
And
You
were
can
you
email me
saying,
and I'll follow up with it.
yeah, were you saying on your last slide that your contact information, is there one more slide after this?
Yes, there is.
Well,
There
let's put it
is.
up there. Um, and that way,
She may not be there to click.
Chidima, would you be able to click forward to the last slide? There we go. So, yeah, if you want more information about Children's Rehabilitation Service, you can just Google that, Alabama Children's Rehabilitation Service. You'll probably get right to their website. And when Tammy was saying, to contact a parent coordinator or to contact her, and she would connect you with somebody, those are two great resources right there, the CRS website and then Tammy's email address. You can also send questions in response to the email that you're about to get with the evaluation form, and we'll make sure and get it to the right person. Um, Once again, Tammy, thank you for being with us. I appreciate all of you joining us today for this very personal and important information. And I hope you all have a wonderful evening.
Thank you guys.
Bye.
Bye bye.